Welcome to Healthy Mind Science, a show dedicated to translating youth and young adult mental health research into the real world. We have conversations with experts in psychology, neuroscience, human development, computer science, education, and more, with a focus on helping parents and educators take research findings into their everyday lives to ultimately better support our young people. Healthy Mind Science is an affiliate of Center for Healthy Mind and Mood, which is an interdisciplinary research center at University of Colorado Boulder on a mission to increasing emotional resilience and ending youth depression. I'm your host, Alicia, and let's get started. So today I have with me Dr. Theodora Ciasparri, and Dr. Chaspari is an associate professor in computer science and at the Institute of Cognitive Science at University of Colorado Boulder. You have a bachelor's degree in electrical and computer engineering from University of Athens in Greece. You have a master's and PhD in electrical engineering from University of Southern California, and you've won several engineering, teaching, and research awards. So we are so excited to have you on, and I'm really excited to talk about one of the recent article that you've published. But before we dive into the article, I'd first just like to welcome you and also get to know you a little bit more as a scientist and as a person. So why don't you just tell us a little bit more about your background?
Thank you, Alicia. It is really great to be here with you today. And thank you so much for the invitation to be part of this wonderful podcast. So my background is in engineering, but I have been working with collaborators from psychological sciences and neuroscience for some time now, since my undergraduate thesis, actually. So I feel that while I'm in engineering, it has been really rewarding to sustain these interdisciplinary collaborations with psychology. And my lab focuses on modeling human behavior. And in order to do so, we are using artificial intelligence and signal processing methods in order to better capture and quantify different aspects of human behavior, such as emotion, stress, engagement, or even clinical outcomes, such as depression.
Awesome. I'd love to learn a little bit more about like what got you interested in all of these pieces. Like how did you get interested in this topic?
Oh yeah, so that's a great question. So when actually this again has been from undergrad. I first took my signal processing class, I think when I was in sophomore year, and then that was really fascinating for me because I always liked math, and signal processing is really heavy on math. But then I could really see how math can be applied to the real world. And why was that? Because with signal processing, we can understand images, we can understand speech. So this allows the computers to be able to understand, for example, what's in an image or what are we speaking. So then I really found this very fascinating. And moving forward, I was able to work with in these interdisciplinary projects as part of my undergraduate and graduate training. And I was really lucky to work with teams in psychology at USC. And this is how essentially everything started.
Yeah, very cool. Like, you talked about you can kind of see like math actually being applied. Like, what are we missing the mark on, or where do you think we should be? I don't know how to ask this question. Like, what are some of the possibilities that maybe we are tapping into or we haven't yet?
Yeah, so definitely math and machine learning in general gives us a powerful tool in order to obtain data-driven insights into things. In our case, for example, if we want to obtain data-driven insights into human behavior, definitely these types of techniques can give us a powerful approach in order to do that. However, there are various limitations when it comes to this. The main thing is that human behavior can many times be very diverse, very different from person to person. And also it can be affected by various factors in our everyday life that it's not always easy to account for. Like, for example, physiology can be an indication of stress, but it can just be an indication that we have taken a walk. So these are all factors that are really challenging when we try to model this type of data.
Yeah, that's super interesting. I mean, I feel like there's so much talk about like possibilities and concerns, but I think I really liked how, like you described it as a limitation. It's not like there's all these possibilities, but there's still limits to what we really can use, how we can use the data, because especially around the human experience, it is so complicated. Like my life is complicated, even though it's pretty good, it's fine, but like there's, there's so many layers and factors in the day to day, in the moments to moments, over years. It's so interesting. So I appreciate that you sort of have that lens, and it shows up in your research too. But it's really cool to kind of hear both. There is so much potential and possibility, and I really do feel that in your writing. So it's really cool. So let's dive into it. Let's talk a little bit more about your article that you wrote. So the title of the article is Deconstructing Demographic Bias in Speech-Based Machine Learning Models for Digital Health. And you have co-authors Yang and Elatar, and I'll link that in the show notes as well. So if anybody wants to read a little bit deeper into this, that would be great. So maybe let's talk a little bit about what demographic bias is, what speech-based machine learning models are, and then digital health. So I think it might be helpful just to sort of like maybe at a high level, what are we talking about when we're talking about these three concepts?
Yes. So demographic bias is essentially is a concept that we use when we can observe disparities in decision making across different types of socio-demographic groups. And that might not only be in decision making, but it might be, in our case, for example, in health outcomes. Or in the way we address people's health, in the way in the way healthcare works. So, for example, we know in healthcare that there are demographic disparities between white populations and people of color. We know that consistently people of color receive lower quality healthcare and do not receive as many screenings as white populations. And this, of course, is also reflected in health outcomes and in the way treatment works. And we know that that this happens, of course, for physical health, but of course, this has implications also in mental health. Like people of color tend to receive less mental health care in terms of in mental health care therapy or other treatments. And there might be various factors for that either come from less information or stigma. Or even sometimes the life that the people of color in the United States might have had, because many times they tend to come from households with not so many resources. So essentially, because the data that we use in machine learning algorithms reflect the society that we live in, these types of disparities might propagate into the algorithms that we build. If you think about it, just the fact that people of color are underrepresented in user studies, this means that we have less data for them. And this means that we will not be able to design accurate models in order to fully reflect and capture clinical outcomes. And of course, this might have implications also in the way we design algorithms. And the reason for that is that in research, again, in the research teams, people of color tend to be underrepresented. And when we have underrepresented segments of the society, when we build an algorithm that will actually be implemented in the society, this can contribute to further disparities.
Yeah, I was reading another article, which I'm gonna actually share too, because I think it gives like a little bit more introduction around specifically like the mental health and the psychology like impacts and potential too that AI can kind of support. But I think one of the things that stood out to me was there was like I think 15 decision points in developing a machine learning model, or in kind of like the data that you're
Yes.
looking. I was like, oh my gosh, like there's so many decision points and ways that you can sort of either increase or expand kind of the bias that's embedded within if you're not doing these checks, as well as ways that you can sort of mitigate that. And I think I was like, oh my gosh, this seems so overwhelming. I can't even believe how many sort of entry points for either expanding or limiting bias that is possible. And I know you didn't even cover all of them, but yeah, I was just like, oh wow, we have. I don't know how much tech and other industries, how many people are actually even looking at this when they're building these models. I don't know if you have a pulse on that. That's not necessarily what we have to talk about, but I thought that's really interesting.
Oh, yeah, that's so true. And it's very interesting because people think that artificial intelligence algorithms are really objective, but there are so many decision-making points that happen into these algorithms, and these are human. These are humans that make these decisions. So the objectivity might not always be quite there.
Yeah, but it really has been, I think, especially early on, before I sort of started understanding a little bit more of some of the limitations that you were talking about. I kind of just thought like, oh, this is like must be really a little bit more non-judgmental, non-biased. You would think and feel, I guess, because of the way it's sort of marketed and shared. I don't know. So it's interesting. Well, let's maybe dive into specifically speech-based machine learning models. So I actually haven't heard much about this, and so I'd love to know, yeah, just a little bit more at a high level of what that looks like and means.
Yes, so speech can really serve as a valuable biomarker for certain mental health outcomes. For example, for the case of depression, we previous studies in speech and linguistics indicate that people with depression might have a speech that is more monotone. There is not so much variance in terms of the spectral characteristics of speech, and also their speech might be slower compared to healthy counterparts. So what we want to do for speech-based machine learning is that we are trying to leverage whatever speech characteristics might be useful for the outcome that we are trying to predict. And we have machine learning algorithms learn these speech patterns. And this can happen in order to estimate, for example, the severity of depression for a patient. It can happen in order to estimate mood outcomes, because we also know that there are several spectrotemporal patterns in speech that might be indicative of emotion. And therefore, there has been a lot of work in domains such as affective computing that focuses on estimating emotions from multimodal data and particularly from speech. And the good thing about speech is that in contrast to image, is less privacy intruding. Although there are privacy risks with speech, but at least it does not have the visual components and the facial components that images have. And the good thing is that we can actually record speech pretty much continuously throughout the day. Again, there are various privacy concerns when we do that, but by doing so, we might be able to better understand what's going on in people's lives and what might be moments of interest, of clinical interest, that we could potentially intervene on.
Yeah, and I guess that's sort of the third kind of component of the study which is really around digital health, and it's that translational piece of why does this matter in kind of with the anxiety and depression. So maybe talk a little bit more about either your experience around digital health or what we mean when we talk about digital health.
So digital health are technologies that integrate various digital technologies such as mobile applications, AI, and wearable devices in improving, and the goal is to improve patient outcomes. The great thing about digital technologies is that so far, clinical diagnosis and monitoring has been happening inside hospitals or inside clinics. So digital technologies enable us to actually now put this diagnosis in the real world, in the outside world. And why this is so important is because human behavior happens in real life, right? Human behavior really doesn't happen in a doctor's office. So through that, we are able to better understand what's going on and what are points that might be clinically meaningful in people's lives. And of course, there are various risks when we deploy digital technologies and digital health technologies, starting from privacy risks. And I know that many people are skeptical about that, both patients and clinicians, but also potentially ethical risks. So, for example, there are apps that there is research that aims to forecast suicidal risk, right? So there are so many ethical considerations around that and around how these technologies would be best deployed.
It's yeah, there's so much, again, like you said, it's so much potential and opportunity because it's really able to monitor and to understand real world and real world experiences of people and really capture the nuance and complexity of humans, but at the same time having kind of that balance of privacy and ethical. I think especially when I think about young people who may be using tools and technologies that maybe aren't necessarily forthcoming about how or what they're collecting or how they're collecting it or what they're using their data for. I think that's super interesting because we have this broad, bigger conversation, but then we're not even focused as much on youth and young adults, specifically youth who shouldn't have to make those decisions quite yet or have to be thinking about those privacy and ethical concerns. Like we should be thinking about that as the adults in this space to protect them, at least until we better understand and curate and test some of these digital health technologies. But at the same time, it's like the suicidal risk and being able to identify somebody sooner and earlier, it's like has so much potential and could literally save somebody's life. And that is, something that I think like, let's continue to work on it, but we also need to make sure that we're being really thoughtful about how we do these things.
Of course, and especially with young people, I think there is also a big part is education, and it's important to understand that our digital footprint is everywhere and it's growing. And technologies are also the good, but also the very bad thing about technology is that it advances way faster compared to societal norms and legislation. So this is really a big challenge here.
Yes. Oh, that's like a whole nother, we should talk about that on a whole nother podcast probably. Well, let's dive into the study that you did. Maybe if you want to share like a high level of really what the goals of the study were, what you were trying to understand.
Yeah, sure. So the goals of the study were to better understand socio-demographic disparities in speech-based machine learning algorithms that were used to estimate outcomes such as anxiety and depression. The reason why we use those two outcomes is that there has been a lot of work in our field that demonstrates that speech is a predictive marker for both anxiety and depression. And now there are systems that are starting to get deployed on tracking these outcomes in real time. So we were very much interested to see with the current data that we have, at least with the subset of data that we have, to what extent there might be disparities in the way machine learning algorithms detect anxiety and depression from speech. Our study demonstrates that there are differences. First of all, as we expected, there are differences between socio-demographic groups in terms of the acoustic measures that are being used as an input for these algorithms. So for every machine learning algorithm, we use several measures as an input, and then we get the output. These measures, in this case, are prosody measures that reflect the intonation and the loudness of speech. We already knew that from previous work, but we also further verified that these speech measures depict differences between men and women, which is something that we knew because of the anatomical characteristics that influence those measures, but also between certain between races, race/ethnicity groups. So in our case, we had data from white participants, Black, African American, and Hispanic participants, and we observed certain differences in the acoustic measures across those groups. So these differences were also further partially demonstrated at the outcome of the machine learning algorithms. So we found that machine learning algorithms do not equally perform across all groups. And something that we actually found that was, I think, the most interesting was that if there are differences in outcomes with respect to clinical outcomes across groups, these are not being translated in the way machine learning algorithms predict those outcomes. So the example that is most indicative there is for depression. We know that women have higher rates of depression compared to men. And we know, scientifically speaking, that there are various reasons for this prevalence. So our data, our ground truth data actually depicted that, but this was not translated in the algorithms. So the algorithms were not able to capture these differences between men and women in terms of the outcome of depression that were actually meaningful. And you can imagine that if we cannot capture this might be meaningful for further treatments.
Yeah, so let's just zoom in just so I can make sure I understand. So when you're talking about ground truth, you're talking about like what the actual, when you're doing measures of anxiety and depression, maybe a higher level depression in one person, but like the machine, when you put it in the algorithm, it's not predicting that same.
Exactly.
Basically when it should, because
exactly.
literally using that data to, okay.
Exactly. Yeah.
Okay. Yeah. Super interesting. So what does this mean? What do you think this means, like practically speaking, for, you know, I mean, just, yeah, what does this mean kind of for the real world?
Yes, for the real world, this definitely has important implications in the way these types of algorithms can be deployed and can be used by people. Imagine that an algorithm like that could be used to track the progress of a treatment for a person. And imagine if this is not being tracked correctly. This can really have important implications in the way the treatment is being designed, as well as important implications in the interventions that this person receives. In addition to that, there is a whole other line of work that such algorithms could be used as assistive technologies for clinicians or even for physicians, because there are mental health screenings that happen in the physicians' offices. So if these algorithms do not perform well, of course, you can understand that there are important implications in how a person's mental health is going to be managed along the road in the future.
Yeah, I can imagine a clinician working with a young person and sort of monitoring health maybe in their day-to-day and not necessarily catching some of the like anxious experiences or depressive experiences or mood states because for some reason they're not catching it in that particular person because the model wasn't trained for them potentially or with them in mind.
Absolutely. And also something that that sometimes might contribute is that these algorithms are being many times, especially for example when we do mood tracking, we pre-train those algorithms with self-reports, right? We ask people to tell us, how do you feel? Depending on a person's personality or a person's, background, they might not report, they might underreport, right? And this, of course, can be can affect the outcome of the algorithm, because if a person underreports how they're feeling in the beginning, then the algorithm might not be able to capture their actual mood along the road.
Yeah. Ugh, so good. What else should we know about the study, or what do you think, anything else interesting that you wanted to share?
So this was just a preliminary study with two smaller scale data sets. There has been other work that actually demonstrates similar results. But it is important to scale up those studies, and actually it is important to have available data to conduct such studies. There is really limitation there because the speech data sets that we have available as a research community, many times we do not really have meta information that is related to demographics. So this is very difficult because if we don't have this, we cannot really conduct that research.
Right, right. Ah, that's really interesting. Um, well, what do you think as far as like parents and educators who work with young people who are also trying to really even just understand what AI is what it's doing with our young people, how young people are using AI? Like, what do you wish that like every educator and parent knew about just artificial intelligence and machine learning? Yeah.
That's such an important question. So AI is in our lives right now, whether we want it or not. It's so much embedded into every facet of our lives. And I think it's so important to educate young people from very early on, from elementary schools, about what are the capabilities of AI, how AI works, even at the very high level, and what are the challenges and limitations associated with AI. If we do this, then hopefully we'll have a society in the next 20 to 30 years of people that are well informed about opportunities and limitations of such technologies. And I know that there are schools that have started doing that. But I also know, I've heard somewhere in another podcast actually, that there are disparities, like schools in neighborhoods with higher income actually are more advanced in AI education compared to other schools. And I think another very important aspect of that is that many times as researchers, we develop those algorithms in isolation from the actual people who are going to use those algorithms. It is really important to obtain user input early on and throughout the development and the deployment of these algorithms. Because if we do that, then hopefully these algorithms are going to better serve the people that they are intended to.
Yeah, oh, that's so good. And I think, you're talking about sort of like education. And I think one of the things that I've witnessed just sort of in the news and type of thing is that a lot of schools are sort of like we're at first anyways, like no AI. We're not using it. You're not using it. It is just to, help you cheat and we're not supportive. And so I do think I've heard some of that like transition and change. So I'm hopeful, but I think there are a ton of disparities there because there has to be somebody who's excited to want to learn more about what is happening. And then how do we educate our young people on what is happening and how to use tools and how to leverage them while also understanding the limitations and concerns. I think there's so much there. Like I'm trying to keep up, but it's not my main job or role. Like I'm trying to sort of understand how this technology is advancing, how we can use it and leverage in my work. And I think it's just, yeah, there's so much information. And like you said, it's happening so fast. It's really hard to keep up. And we know that historically, education is usually far behind, and that's frustrating as an educator myself, and also like how do we make it faster so we can adapt and be really prepared for what's happening now, not just what's next, but like it's happening now, and there's so many, I mean, again, possibilities and limitations.
Yeah, and I mean, our educators are doing such a great job and they have so many things to do. I cannot imagine how they really now have to deal with another level of complexity, right? To try to integrate AI into schools or even teach our children about AI. So these are all very difficult questions that need to be answered, and there needs to be a framework that somehow this can happen.
Yeah, for sure. Well, I'd love to know like what excites you? What's a project that you're working on either now or that you really want to work on in the future?
Actually, a very exciting project that we have right now is focused on how we can design such technologies in a way to have the user in mind. So we're trying to design similar digital health technologies in order to assist clinicians in their diagnosis and treatments. We are essentially our focus is to co-design these technologies with people. So get feedback very early on and throughout the process of the design. While we are only doing that for clinicians right now, this is something that has to happen also for the end user and the patients. And the entire research community is very actively trying to pursue this direction.
Yeah, I love that. And I think, especially with young people, they're often designed for and not with in collaboration. And then oftentimes then those technologies may be amazing in the clinical setting or in a research context, but then they're not really translating in sort of the day to day because users are just using it for the actual benefit versus not like, oh, this actually doesn't benefit me because I'm not using it in the same ways in the research context, or it's not designed for me and to keep up with how young people interact and work in the world. So yeah, that's really fun. And it sounds like a really exciting project. Awesome. Well, thank you so much for being on the podcast, and we're so excited for the work that you do, and it's such important work that you're doing in the world. And I'm really excited to see like how you are, a thought leader in this space because what you're writing about is just so critical, and we need more of that. And it needs to be out more, which is why I'm really excited to have you on the show and support your work. So thank you so much.
Thank you so much. It was really a pleasure to be here with you today.
Yeah, of course.